can see the beginnings of a market that would come and develop, and that we do not lose the type of quality that most people in this country want and have.
Trying to get questions in.
Thank you. Let me just make one comment from the last question. I talked about Ted Kennedy opposing health reform way back when. I think in recent interviews he points that to the worst thing he's done in his career in the Senate, opposing that. He was going for the whole loaf, did not take half a loaf, and as a result ended up with nothing. And I think he points to that as one regret he has had. They could have built on that and done extremely well. One of the things that, in response to the question on pre-existing conditions, again, that's one of the part of the 80% that we agree on. You should not be denied coverage if you have a pre-existing condition. Unfortunately, again, you can't make that work unless you go into the 20%. If you don't have universal coverage, the pre-existing condition problem cannot be solved, because if people can wait to buy insurance until they get sick, the only people that will buy insurance are those that are sick, and the average cost will go up. They've tried it in several states. Costs went out of control, and they had to either go into a universal coverage situation or just drop it all together. And so when you start, and then how do you get universal coverage? You can't force people to buy things they can't afford, so you have to have subsidies. So you have to have, with the present system, employer mandates, things that are not popular. But if you're going to solve the 80% that we agree on, you got to go into the 20% to actually do something about it. This is where the question came up: how do you get competition? What drives the competition? The public option is what drives it. You're running an operation on a 0.5% expense. If you want to compete with it, you got to get your costs under control. Without the public option, trying to get universal coverage, what you end up with is a situation where you are requiring people to buy product from a for-profit, sole source corporation with no check on prices. Requiring people to buy product from a for-profit, sole source corporation with no check on prices. As John McEnroe would say, you can't be serious. That's what the public option is there for, to check on prices so that there will be meaningful competition, which does not exist in most states.
Next question, Dave.
I'm just going to read the next 5 names to get people lined up. We have Patricia Churchill, Kathleen Wilcox, number 7, I don't have your card, Mary Evans, and Lisa Keck.
Okay. Line up. Welcome.
My name's Elizabeth Butler, and in business school they didn't teach us that the government entering the game would promote competition. That, to me, just for the record, sounds crazy. I'm here today because I'm worried about the national debt, and I'm even more worried about paying additional taxes, lots of additional taxes, and I'm wondering how in the world can we afford to pay for this?
Oh, wait, is that a question within 2 minutes? Why don't Representative Scott go first?
Okay, well, I put a chart up what we're trying to pay, the additional taxes, $544 billion over 10 years.
No way.
1% tax on that portion of your income over $350,000, 1.5% of that portion of your income over $500,000, and 5.4% of that portion of your income over $1 million. Now, remember that people are paying a payroll tax, which is about 12-point-something%. Payroll up to $90,000, no payroll tax over that. So adding what is essentially a payroll tax, income tax on those levels, I think is fair. You have to pay. We're paying for it. The easiest thing to do, we can agree you need to do it. But the thing that gets sticky is we want to pay for it so that it is deficit neutral. Now, the bills keep changing, so that might not be enough, might be more than enough. But when the final version is voted on, there will be the payments to pay for it. And can you pay for it? The question is, can we afford, if we don't do something, can we afford where health care costs are going? That's what we can't afford. And if you look at the $544 billion in the context of some of the things that are being discussed, extend all the tax cuts from the 2001-2003, that's $4.5 trillion. Repeal the estate tax, that's about $600, $700, $800 billion. We're looking for about $500 billion within the context of the things that we're talking about doing. My view is you ought to do health care first and then talk about other tax cuts later.
That is such a big question. I mean, really, it goes to Bobby's statement that you know, we agree on most, but then you got to bring in everything else. I mean, how they're paying for this right now and in the proposal is, as Bobby said, number one, it's through taxes. And the president was on TV last night or yesterday morning saying, no, it's not new taxes. Whereas in this bill and in the Senate bill both, it calls what they are charging employers and individuals a tax. It's in the IRS section of our bill and the House bill, and it is an excise tax labeled as such in the Baucus bill coming up tomorrow. So that is that, along with the surtax, as Bobby says, that somehow in these economic times we should be imposing on individuals who run small businesses a surtax. I mean, right now, let's not forget, healthcare is a huge issue, but it exists in the context of this struggling economy that we've got. So if we're going to say to people who want to create jobs, it's going to be that much more difficult because for every job you create, you're going to have to pay 8% more of the salary. You're not going to see jobs come back so quickly. So I think the question is a fair one. Also, I mean, we saw that a couple $100 billion is being paid for by cuts to Medicare. And where they go to cut in Medicare is Medicare Advantage. Medicare Advantage happens to be the portion of that program that allows people some choice to get outside a government program. So again, I think as a whole, what ends up happening in this design is you have more and more people in a government program, because I disagree and continue to disagree with this notion that somehow a government, and Bobby talks about the reduced cost of administering a government program, that's fictitious to believe that can exist in the private sector. It's just not. Our economy is based on incentives, monetary incentives for individuals for opportunity. We're not for unfettered, taking advantage of. We're for even playing field. But so if you have a situation where that competitor has a fictitious environment in which to operate, that means the private sector is not going to be able to compete. You'll have people migrating onto the government plan. And over 10 years, the estimates are by several independent studies that 100 million Americans will be in the government. Now, how does the government pay for it? That's the big question. And we see in systems that exist in the UK and elsewhere, the government can only pay for it by beginning to deny care.
Thank you. Thanks for your question. Appreciate it.